I don't say we talk about vaccinations and everything, but what I wanted to cover today is, by the way, your husband recently went to, I'll tell you about that later. I wanted to talk about today really what is ultimately the most important topic and make sure that you guys are more aware today and really understand what's going on the inside and give more respect to your body in the way that it functions more than you ever have before. No matter if you're a patient or not, I want to make sure that we really get the big idea of how things work from the inside out. So, is it always this loud? You guys really? Yeah. Okay, so you guys just scream. Okay.
We can hear you.
Yeah, it's all good. I'm used to distraction.
We got to tune in.
So, here's the thing. I mean, the reality is, a lot of us just kind of take for granted the way that our bodies function on a day-to-day basis and never really think about what's going on. How do we, do we really have everything that we need? All these things kind of come into question. When the reality is, if you think about it, at any given second, what's going on in your body? What's going on, like right here, as you're breathing, as your heart is beating, your kidney is processing, your breakfast is getting moved through your system. All these different things go on, and we don't really think about it. So I want to really get us actually thinking about that today. And I'm going to tie it all back into how do you keep your kids healthy for life? Because ultimately that is the goal, is how do we make sure that our kids are really functioning at 100%? What does it mean for them to be healthy? Because unfortunately, you look around and you see most of us really don't have any idea what it means to be healthy. Like, we look good and we feel good on the outside, but does that necessarily mean that we don't have cancer developing in our bodies? Does that mean that we don't have heart disease developing? And when you see that heart disease, diabetes, and cancer, and you add in obesity too, literally now killing 6 out of 6 Americans. You see that most of those people, they feel pretty good most of the time. They don't feel any outward symptoms. So what's actually going on? So here's what it comes down to. When you look at it, you basically, your actions can tell you kind of where you are, on this. And I want to make sure that's aware first, because if the prevailing thought, like let's say that something's going on, anybody's kids ever have a fever before, or an ear infection, okay? So when they have a fever or an ear infection, what do?
Give them medicine.
Okay. So some do nothing, some give medicine, some take, even those that don't do anything, some have a thermometer, and take temperature, and do all these kind of things to monitor and regulate and try and figure out what's going on, right? So basically, we have this, what I want you to see is this duality of process, that one of two things are happening. Either it's in the hands of the body knows exactly what's going on and it's going to fix the problem, or we have to figure out what's going on so that we can fix the problem. You see that? There's basically two sides to that coin. So, the question comes down to where are we in that scale? Because it's not just a black or white, right? You can try to figure out what's going on, do your best to try and, you give drugs and you give vitamins or you give all this other stuff, but then ultimately the body heals itself. But it was a combination of the two. It wasn't just really sticking to one side or the other. So I'm not saying you need to stick to one side or the other. There is an intelligent choice that goes into that. But what I want you to do is really see what's going on the inside if you really don't get the full extent of that. So here's the thing. What's the big difference between life and death? What's the difference between living and death? If you could break it down into literally one word. Consciousness, okay. Breathing, okay. What else? Circulation. Okay. Movements. Is that what you said? Yeah. I think really, if we break all that down, probably the number one thing is what you said is not necessarily movement, but motion. Okay, the primary difference between alive and dead is motion. It's the ability to have motion. What is consciousness? It's consciousness doesn't happen in a rock. But the difference between a rock and most of us is we actually move. So the primary difference is motion. So if you think about that, okay, that motion, what is needed to create motion?
Energy?
Getting a little bit deeper here, yeah. Energy, very good. What does energy produce, though? It produces force. Okay, so that energy produces force. Okay. All right. Can you be my what is it? Sign language? Can you do sign language? He's training. It's okay. Just mimic what I do. You'll get there. So that force creates motion. Okay. So the next step obviously is what produces force? Where does force come from?
What force? Life force.
The force within the body, yeah. What is that force? Is it
brain?
Right? Exactly. But
He knows the answer.
on it. So let's break it down to its basic fundamental level of living anatomy. What is that? It's called a cell, right? So let's just go straight all the way back to an individual cell. Okay, so that cell has to have power. That it has to have force to produce that. To produce that motion within the cell. You take this out to a higher level. You now can look at, let's just look at the very simple fundamental principle behind every organ function in the entire body. That is muscular contraction. Okay? So any process, it doesn't matter what it is, for your colon to be moving, for your heart to be beating, for your kidneys to be processing urine, for your muscles and your eyelids to be flipping up and down, for you to be breathing, it doesn't matter what it is. Every single living function in the body has to have muscular contraction for that to occur. Okay, so you have an individual muscle cell that drives literally every process in the entire body. Even the cells that are not muscle cells, they require muscular action in order for that to function. Think about it in terms of a white blood cell or a red blood cell. If a white blood cell or a red blood cell had no motion, what would they do? They would die. Absolutely nothing would occur. What are they completely and totally relying upon for them to do their action? Your heart to be beating, right? Which is muscular contraction. So does everybody see that? That literally every single physiological process is based and centered around muscular contraction. Okay? So now let's look at just an individual muscle cell. It would be so cool if we had a whiteboard. You have a muscle cell, okay, and it's just basically one single strand, right? Everybody remembers that from science class. And basically its job is to do what? It does two things. What is it? Release and contract. So its job is to do this. Get short, get long. That's the entire process, is it just gets shorter and longer, shorter and longer. So every time that it makes a contraction, it's producing force, right? And that force produces action within the body or motion within the body to produce all these other functional processes within the entire system. So now we know that individual, all of your anatomy, everything that you're doing to stay alive right now comes down to one simple process. A muscle fiber getting short or getting long. Now it comes down to the basic fundamental question. What produces it? What makes it go short, long, short, long? What is it?
Brain,
It's electrical impulses. It's neurological impulse from above down, inside out. That's what produces that muscle fiber going short and long. Right? Are you following?
Stay with the hand.
Go right up to the line.
Yeah, there you go.
Right up.
So that, all of the, there you go, high fives to everybody that gets one right. So all of those processes come down to that short and long, and that comes from a neurological impulse. So what we have is a muscle fiber, and you have a nerve ending that's going to that muscle fiber that's giving those signals to contract, relax, okay? Well, there's that neurological impulse that's there at that nerve ending. How does it get there?
You passed my science work a long time ago.
Follow the path.
Okay.
You've got a nerve ending. What's attached to a nerve ending? The nerve, right? Okay, so the nerve, it has an end called the nerve ending, and that's what's actually attached to those muscle cells. So that signal, of course, has to be able to travel down that nerve in order to create that muscular contraction. You follow? Okay? So now we can travel a little bit up further. Where does that nerve interface with? Your spinal cord, right? Okay, so your nerves interface, they stem out from your spinal cord, and your spinal cord goes all the way up and attaches to your brain. So where is that life force actually produced? Your brain. Okay? So every doctor on the planet, every doctor that knows anything is going to agree with you that you say what controls all function in the entire body, they're all going to tell you the brain. Everybody knows that. Okay?
And that's where we get the term brain dead.
Bingo. When you have sections of the brain that are no longer producing force, so literally, I mean, we say that the muscles are producing force, but in reality, they're not. All force starts right here. That's what I wanted to get back to, is show you literally every single force, literally the life in your body is created right from the get-go, but that force is turned into motion through the muscle fibers all throughout your system. Okay? So, if that's the case, what is the most important action in the entire body? What is the most important part of your entire body? Your brain. Which is why it's encased in what? The skull. It's completely surrounded. Who in here has dropped their baby before? Yeah, nobody's going to raise their hand on that. Yeah. Most of our kids, if they haven't been dropped, or fallen off of something, they've at least run into a wall once or twice, right? So thank God that they have a skull, and it's round because it absorbs force a lot better that way. Okay, but the skull is not the only, or rather the brain is not the only part that's completely surrounded and encased by bone, is it? What else is surrounded and encased by bone? The spine, okay? So you've got the brain and the spinal cord both surrounded and protected, completely encased in bone. So what does that tell you about the importance of that system? Again, absolutely critical. Now, so take all of this into play, and basically what you have is this. So basically, again, you've got the brain, sending signals down that spinal cord out to every single cell, tissue, and organ in your entire body. Now what happens, visualize your spine is basically a mine shaft, okay, or a well, that you have to get your water out of the well, and all of a sudden, the well collapses in on itself. What happens to your ability to make that a functional pathway? All of a sudden, it doesn't work anymore, right? I'm getting some blank stares on that next. Okay, once again, your brain has to send those signals down your spinal cord, out those nerves, to produce force and motion in every single tissue in your entire body. So let's just take a very clear example. Let's say that you've got a bone in your mid-thoracic spine. Let's say one of the kids falls off the bed and they land on their side in kind of an inverted position. Okay, and that force, do you think that force might do some damage to the spine? Let's say that all it did was it just take one of those bones and it just shifted it just a little bit, and that was enough of a shift to create a door jam essentially in the spine. We call that subluxation. Now that little bit of motion, the common picture, that most of us see with chiropractic is, the whole bone on nerve thing. That the bone is literally putting pressure on that nerve. So you've got the hardest substance in the entire body putting pressure on the softest, most delicate tissue in the entire body. Is that a good thing?
Yeah.
Okay? But see, in nowadays, we see it's a lot bigger than just that. That was the original picture like 100 years ago. But now it goes a lot further, because now we understand that there's this stuff going around the spinal cord called cerebrospinal fluid, right? Okay, and what does that do for you? What does it do? Yes. That's the first time anybody's ever said that, but yes, that is actually true. Refrigeration system, yeah. Okay. It produces, Yeah, Jay, high five. Come on, high five. You're missing.
That's the toughest question yet.
The main functions is it provides oxygen and it provides nutrients to your spinal cord. So when that is flowing at 100%, you have no interference. It's just like your cardiovascular system. It's pumping and everything is working fine. But of course, what happens in somebody with cardiovascular disease who starts building up plaque in their coronary arteries? What happens to them? Right. Why do they have a heart attack? Bingo. Because all of a sudden you can't get enough force to keep things active. The cells start dying within the heart, and now that organ fails. Okay? So this is the same process. You take again that bone and you shift it. Not only is it putting pressure on the nerves, but what do you think that does to the cerebrospinal fluid flowing through the spinal column? It stresses it and sometimes collapses it all together if that subluxation leads to a chronic pattern, which we see in probably at least 6 to 7 out of 10 Americans. 6 to 7 out of 10. Patients in here? No. You see how common it is. That we see, instead of having a curve like this in the neck, that it straightens out to some degree. And any kind of straightening, just a little bit of straightening from 43 to 34 degrees, most people are below 20 because of computers and cars and video games and book bags and TV and everything else. We destroy our curves. So when that happens, it's clear in the research that you cause compression of that cerebrospinal fluid around the cord. So now not only are you putting physical compression on those nerves, but you're also blocking off the circulation to your nerve system. So what happens to the cells when you cut off blood and oxygen? They begin to die. So now you have basically 2 levels of neurological impairment going on there. Are you going to tell that right away? Let's say as soon as a kid falls off the bed and they plunk on the floor or they bang their head on the wall and that bone slips out of place, are you going to be able to know right away that there's a problem? Is your kid going to break a fever or they start getting delirious or malfunctional in any way? No. In most cases, you're not going to unless it's a severe trauma. When do you know that there's a problem? If that's the case, when do you know?
If it is serious,
right. Well, when do you know that damage is now present? Okay. Is that likely to happen in a 1-year-old, a 2-year-old, a 5-year-old?
Well, like you said, if it's serious enough, it'll happen to where you get a fever or, they start getting or throwing up. But that's like you said, if it's serious. But if it's something that is in their spine that's pinching something and they can't talk to tell you I'm hurt,
Bingo.
then I don't know what the effects are.
Bingo. So let's go on that for a second, because here's what the research says. That the average person, they're talking adults here, and adults can communicate. A 5-year-old probably isn't going to be able to tell you exactly what's going on or be able to self-diagnose enough to know that there's a problem. So what the research shows, though, is that you lose approximately 40% neurological function before you'll ever feel a symptom whatsoever. So in order for you to get to the point where, your kid is now delirious, or, has anybody ever had their kid to have a serious fall or anything like that, and you've noticed some kind of serious repercussion afterwards? It takes a tremendous charge. Anybody watch UFC?
Okay.
Yeah, we are too. UFC, Ultimate Fighting Championship. Yes, we'll be having people over Saturday night for that. But the point is, okay, how hard do those guys have to get hit before they get just flat knocked out? It takes it's literally sometimes, they're getting plugged with full force, but then all of a sudden, you see their head practically spin all the way around, and that's finally enough of a neurological impact to create a manifestation. So you think about it in that aspect. That happened in an instant. The body had no time to respond to that trauma. You get that? So the difference is time. That is always the underlying factor. Look at Christopher Reeve, Superman. What happened with him? He got thrown off a horse. He broke his C2 his bone slipped forward just enough to bruise his spinal cord. But it was fast enough that literally it shut down all function in his entire body because he didn't have the time to respond. The brain could not adapt to that. So you take that down to a situation with your average American. Do most of us have that kind of a trauma that walks us in to say heart disease or irritable bowel syndrome? But if that's the case, see, we know ultimately that all those things are also caused by neurological interference, right? I mean, we just laid all that out. All function is controlled by neurological interference. Therefore, we know that that's where it's coming from. So if it took an instant to create that kind of damage, when you get knocked out, how much more damage do you think it takes before you see enough of an interference within the body that you're now seeing the manifestations of that? You see the big picture? So it takes a lot of problem to create a little bit of symptom. And that's the big key factor there, is that it's just, most of us aren't going to see that happen for years and years and years. So now it goes, let's take it full circle back to that kid. Your kid falls off the bed, or Jalen, what was it, a couple weeks ago, we were out picking blueberries and he gets on a swing and takes a nosedive off the swing, and then the swing comes back and clocks him in the head again. Okay? So anybody ever had an experience like that? Probably every single one of us have had an experience like that with our kids. So do you think you can fall off on your head, and then you can get whacked in the head with a big wooden swing and come out of that unscathed? Do you think there was even a possibility that that spine is just going to stay just absolutely perfect in position, no problems whatsoever? Yeah. All it takes is a little tiny bit of a bump in the wrong direction, and the spine can get locked up, again called subluxation. So now we leave that in place. Was he okay 5 minutes later? Sure. Yeah. I mean, we look at him, no problems 5 minutes later. I mean, he's awake, he's out playing, he's got a bump and a bruise on his eye and everything. Probably, had about half a black eye the next day. But on the outside, he looked perfectly fine. So, see, most of us would look at that and say, okay, well, since he looks okay, then he must be okay. Tell me, how is that any different from, let's say, our parents who, anybody have a parent who had heart disease or cancer? Or a grandparent? Okay? We'll just use the example of Jen's mom. We lost her to cancer about, probably 10 weeks ago? Yeah. And the funny thing is she was down here just 7 weeks before. Okay? 7 weeks before. And for the most part, on the outside, she was fine. She was perfectly fine. So how is that situation a whole lot different from his situation 5 minutes after he fell off that swing? See, it's not much different. They both felt fine. The difference is always time. The difference is always time, because if we had left that in place now with him, we just left that subluxation in place. Okay, never fixed it. What is that going to do? Is that going to self-resolve? Sometimes it might. How do you know?
Right, how do you know? I just kind of move around.
Right. There's actually an answer to that. How would you know? How would you think you would know if the spine is in its correct position? X-ray. Yeah. So, you would actually know based on X-ray. You can look at an X-ray and see is the spine in its perfect position. But I'll tell you, after 6 years in practice, very, very unlikely that it's going to completely fix and resolve itself, especially to a level where it's 100% functional. If you have a serious, anybody ever have a major pinch in their back of their neck or something like that? Okay, there's a definite difference. I'm totally with that there's a definite difference between when it initially happens and you can't move and you have pain running down your arm, or you got pain running down your leg or something like that, and then a few days later that pain seems to have gone away because it resolved to a certain level. But that's a far difference from being resolved symptomatically to the spine is back in its 100% perfect, optimal, functional condition. The spine is completely mobile, it's working fine, no pressure on the nerves whatsoever. There's a big gap in the difference there. So ultimately what it comes down to is those problems, they don't self-resolve. In most cases, probably 98% of cases, they don't self-resolve. So that gets left there. Most likely the kids are not going to feel anything. They may, if they stress the body too much, they may develop an ear infection. If your kid has an ear infection, clear-cut sign that there is a serious underlying issue. Clear-cut. I mean, there's no question to it. In fact, the strongest research in chiropractic, you understand, is on ear infections. The correlation between ear infections and subluxation is crystal clear. Okay, so that is an absolute. But most cases outside of that, you're never really going to know that there's a major issue until years down the road, when that's had enough time to deteriorate the situation into where now the kid is developing, say, headaches in their late teens. Or is developing, if it's a girl, developing hormonal issues when she's 13 or 14. She starts having symptoms of endometriosis and all this other stuff. So all of it comes back to then, do we pay attention to our bodies based on the way that they seem to be working on the outside? Or do we pay more attention to keeping the body at 100% functioning from the inside? That's ultimately the big question, you see? Because the reality is this. When we break all that down and you look from a functional level, who understands better of how to keep the body healthy? We as the parent, me as the doctor, or the body which has been running millions of bodies for thousands of years at incredible rates of efficiency. I mean, think about it. How many times is your heart beat every single day? How many breaths do you take every day? How many times your eyelids flip up and down? How many pounds, probably tons of food has your colon and your stomach processed in your lifetime? I mean, think about the power that's going on there and the efficiency. I mean, if we apply that to the mail system in the United States, that would probably be it would probably be on the level of losing one letter in 10 years of all the mail that we process in the entire country. That would be about the equivalent. I mean, it is incredibly the efficiency that is going on at every single moment. So which one's better at keeping our bodies healthy? That power that's already inside of us that's been doing it whether you think about it or not, or us trying to figure out what's going on and just going based on what we know? Which one would we rather rely on? A, right? So now obviously, how do you do that? If that's the case, how do you do that? The reality is we don't have anything to do with it. It's either happening on the inside out or it's not. How do we make sure that it's working from the inside out or not? What's the best way to do that? Go back to the anatomy, right? We know where the signals come from. Above, down, inside, out. So if you want that system to be working at 100%, what do you have to keep clear? The above, down, inside, out. You've got to make sure that the spine is completely free and clear of interference. Chiropractic happens to be a means of doing that. And so knowing that, what's the only way? I mean, what's the best way if it's okay? I get that. I understand how the body works. I'd rather my kid be working at 100% rather than 82%. What's the best way, the best starting point to know if there's a problem there or not? X-rays, right. Again, you can look at it at a simple basic X-ray and see what exactly is going on there. I'll give you an example though, just straight out of the research, is Dr. Godfrey Goodman looked at 1,000 babies right after birth. Okay? So I mean, we're talking like kids falling off of beds and kids running into walls and all that kind of stuff. He looked at 1,000 babies after birth, and you know what he found? Over 800 out of those 1,000 babies had suffered trauma to their cervical spines during the delivery process. Now, of course, these are medical births, and in a group like this, we're probably thinking, well, that's probably not as big of a deal because I did a home birth, and that kind of stuff. We did too. I mean, I've gotten to catch all of mine. But still, you think about the forces that's happening there and the hyperextension that they have to go through to get out, and the fact that they've been in that room, cramped up for all that time period. How likely do we really think it is that they're going to come out and everything is going to be perfectly fine? And not only is it going to be perfectly fine, but they're going to grow up into their teen years and they never have to be adjusted. Their spine and nervous system is working exactly the way it's supposed to, and that's the end of the story. And they're going to stay healthy and functional. And you know what? They don't get sick. They don't have ear infections. And hey, they weren't vaccinated, right? So ultimately they should be healthy. And the reality is when you come back to it, it's like, yes, we don't vaccinate our kids. I think Jalen just went out in the hallway. Yeah, okay. He knows where he's going. We don't vaccinate our kids either. Why? Is it because of the mercury? Somewhat. But the reality is, the reason why we don't vaccinate is because the mercury affects what? The brain and nervous system. We know what causes function, what produces motion, what produces life in the body. Therefore, I'm not going to put anything into the body that is going to interfere with that function. That's the same reason why we don't use medications. Because it's not about, well, the medications are toxins. We all know that they're toxins. But why? Again, you see, it comes back to either the big idea that the brain controls all functions of the body, or it comes back to something else. And that's where we're going to bring this full circle again, back to the original question. Where do we lie in that process? Are we really doing the body from the inside out, letting the body heal itself, or are we trying to figure out what's going on? And if our actions come down to not vaccinating because it has mercury and people say mercury is bad, the other side over here is we don't vaccinate because the mercury destroys the nervous system. You see the difference there? Okay, we don't give drugs because we're in the natural crowd and we believe in only giving the body natural things. Basically saying that, food in some way, shape, or form produces life in the body, right? That the nutrients that you put in, that produces life. How many doctors do you know that that's the general idea of practice in medicine? It's the vast majority. I'm talking of the natural doctors. You look at a lot of the nutritionists and all the ones that are writing books like Jordan Rubin and all these guys. Their general standpoint is that it's the foods and the nutrients that you're putting into the body that are somehow producing life. You can see it in the actions and the way that they educate. It's all about what you eat. The other side of the picture is I give the body 100% pure food because that's what the brain and nerve system are designed to utilize in order to maintain that function. But ultimately, none of that stuff is going to make a difference if the brain is not functional. I can give a donut or I can give an apple to a dead body and they're going to do the same thing in the body. Right? They're not going to do anything to produce or take away life. So everything comes down to that simple principle of it's either from the above down inside out or it's from something else. So, this is a big topic especially for groups like this, because a lot of us are, and people are really starting to shift over to the natural side, right? You see people big time. They're all starting to shift over to the natural side. But the problem there is we still don't get it. In a lot of cases, we still don't get it. It's like we just do the natural because that sounds better. But it's still not really based on the true principle that our brain controls all function in our body. And if we want that to continue producing life in the body, it's got to be working 100% above down, inside out with no interference or as little interference as we can possibly maintain because we can't control everything.
Did you bring any literature or anything like that?
No way, I don't do literature.
No, really? Seriously?
No, I didn't.
Or cars or anything?
Didn't bring anything.
Wow.
Here's the standpoint. Really, it comes down to this. If you guys want your kids to get x-rayed, bring them in. We'll do it at no charge. It's that simple. Bring them in. If you get this, you know how it works. You see it. We'll do it at no charge. How often? We typically with kids. Most everybody, kids. two, we'll do once a year. Once a year.
So you feel like there's, I guess the exposure to X-ray compared to the exposure, the deformity of the spinal column is lesser?
Yes, but I'll take it a step beyond that just to show you how much of a freak I am.
I'm just asking.
Yeah, absolutely. I'm totally with you. I'm a freak about that stuff too. Like, I mean, people say that they're going to go and get a CT scan. I go ballistic because, one single CT scan is the equivalent of 1,000 chest X-rays. A mammogram, same thing. 1,000 X-rays, literally in one breast. So you think that causes some cancer? Absolutely. I mean, it's proven to cause cancer. But we actually use digital X-ray. We went through the expense and everything to go ahead and make it digital because that cuts about 50% of the radiation. And then even on top of that, like a standard set of X-rays by insurance standards, and if you were to go into a hospital of just the neck, is 7 films. Okay, so they take 7 X-rays of just one area of your body. To get everything in the body in an adult, we do 4 films. In a kid, we do 2. We do the lateral cervical, and we get the whole body in one shot. So the equivalent of that in actual radiation levels is probably standing out in the sun, full exposure just like this, for about 5 to 7 minutes of actual exposure. I mean, it's very, very small. But yeah. Definitely.
We're gonna wrap up, and then if you want to take it to my microphones off and then see him and just set up, and I would highly recommend it. So